Hi SmartPak fans, welcome back to SmartPak's Ask the Vet video series. Normally, I'm accompanied by Dr. Lydia Gray, our staff veterinarian and medical director, but today we have a special bonus episode with a very special guest, Dr. Andy Kaneps of Kaneps Equine, which is a practice specializing in equine sports medicine. At SmartPak, we've been lucky enough to work with Dr. Kaneps on a few projects, including our SmartFlex IV research study, which we were very proud of, and you can find the results through a link in the description on this video. And thank you so much, Dr. Kaneps, for joining us today.
It's good to be here. Thank you.
We're very happy to have you. And we've gone through the archives of questions back to January 2016 and picked some questions that Dr. Kaneps is uniquely qualified to answer, which would actually be all of them. But we did want to handpick a few that, with the specialization in sports medicine, would be really applicable for you to come in and help our viewers out. So without further ado, let's jump into the first question. This one is submitted by A. Pahula on YouTube. And they're wondering, I have a horse that has been put on a month of stall rest due to a strained deep digital tendon in his hind leg. While his vet is allowing for hand walking on solid flat ground, I was wondering if there are any additional exercises that we can do in his stall to keep him engaged and limber.
The most important aspect of healing of soft tissue injuries is controlled exercise. And that control is important so that we don't overstress the soft tissues that have been injured. Some stress is very important because without it, for example, if we had a horse in bed rest, the tendons or ligaments wouldn't heal correctly. They need some degree of stress, such as walking or standing or other exercises that we'll discuss, to strengthen those tissues and align the fibers. You think of soft tissue injuries like you would with a rope. And a rope is very organized with the strands of the rope making up the strength of that structure. In a soft tissue injury, some of the strands, in this case the tendon fibers, burst and there's hemorrhage. The hemorrhage just fills the gaps between those burst strands and then starts to heal. But the healing is in various orientations, not organized at all, until you put stress on the structure. Additional exercises other than hand walking would include things like moving from a firm surface to a softer surface, say from, hard pack to depth of 3 to 4 inches. That will put some additional stress on the structures. But usually, before we get in the saddle and start riding at the walk, all we'll do to increase exercise is increase the length of time the horse has walked.
So not necessarily more diversity in terms of install activities, but just a gradual increase in the duration of the walking and then the type of walking, like you said, with the surfaces.
That's exactly right.
And so, working with her vet, and it sounds like she's on the hard, flat part right now, and maybe more depth or more time will be coming later.
Yes, that's correct.
Alrighty, well, good luck. We know stall rest can be tough, so hang in there, and you'll be back in it at no time. Our next question is by Sinben, also submitted on YouTube, and they're wondering, what can you tell me about degenerative suspensory ligament disease? Most particularly, what activities, if any, should we avoid?
Degenerative suspensory ligament disease is a really destructive process. It's challenging because there's no specific cure. Once the ligament starts to essentially fall apart, and by fall apart, what I mean is that the chemical links between the fibers of the ligament are not as strong as they need to be. And essentially, the ligament stretches out. So you see the clinical sign of degenerative suspensory disease most frequently as a drop of the fetlock.
And so thinking of the rope example in the last question, like the strands are they're losing their strength, sort of.
Losing their strength, and stretching out. They can't support the weight of the horse normally. There is no specific cure, like I said. We can help by modifying biomechanics of the limb with an extended heel shoe. So that decreases the stress on the structures of the leg. But there's a restriction of this horse based on the amount of degenerative change you have and the comfort level of the horse. Certainly things like real active riding on rough ground, up and down hills, and that sort of thing may not be in the horse's best interest.
So kind of the exact opposite as we talked about with the last question, where you want to gradually increase the stress. Here you want to be avoiding any kind of increase
That's correct.
in stress.
Yeah, that's correct.
Okay. Well, good luck. Our next question is Dressage Girl 101 asked on Instagram, and she's wondering, what's the difference between bone spavin and bog spavin? How do each affect the horse, and how can they be prevented or treated?
Both of those items, bone spavin and bog spavin, involve the hock. Bone spavin involves the joints and the bone, and it's usually osteoarthritis. And osteoarthritis is a degenerative condition of the cartilage and bone that results in proliferation of new bone in the horse's attempt to fuse the joint. Bog spavin is extra fluid in the upper joints of the hock. And that can be also associated with osteoarthritis or inflammation for another cause in that joint. Bog spavin may also be present in the cases in a young horse of OCD or osteochondrosis. There, taking radiographs and finding the specific diagnosis will help identify the cause of that. Treatment of those conditions would be for the bone spavin as you would any osteoarthritis. Non-steroidal anti-inflammatory medications, sometimes topical anti-inflammatories, and in some situations, joint injections.
And is there anything anyone can do at like a preventative measure for either condition?
Maintaining good body condition of the horse, strength, good muscle tone is very, very important. Good shoeing, also working your horse on good footing. You know, rather than a rock hard ring, have something with nice cushion to it. Those factors are the most important parts of prevention. Supportive things that may help, but it's not research supported, are items like the oral joint supplements, medications that may be injected in the muscle or in the joint may help limit the progression of osteoarthritis once it is there.
I think a lot of horse owners, it's really common for them to think of it as an acute problem because it's a problem you find in one area. And so they think, oh, there's something wrong with his hock. But to your point, it's really about thinking about the whole horse and how his whole life is affecting the things that led up to that problem. And so that's the, the body condition, how you're shoeing, how you're riding. All of those things are where these types of problems can come from.
That's very true. I mean, it's wear and tear, and it's going to happen to different degrees in most horses. It's doing the best you can to give the horse the best type of life.
Yeah,
and
set him
use.
up for success.
Yeah, set him up for success.
All right, our next question is from Dallas6101, also on YouTube. And Dallas is wondering, what is cellulitis and how can it be treated? I recently almost adopted a 10-year-old thoroughbred gelding who has cellulitis in his right hind. He flared up last fall, and despite the best efforts of his trainer who used antibiotics and other forms of treatment, the swelling never went down. Is there anything that can be done to treat chronic cellulitis? So what is it? What can we do about it?
Cellulitis is a challenging condition in horses. And what it is an abnormal amount of trapped fluid under the skin. Oftentimes that's associated with an infection. But usually, even when we look for a site of the infection, we don't find it. We look for wounds and that sort of thing, but rarely do we find an inciting cause. It's a vicious cycle because infection and inflammation starts under the skin, then damages the circulation, both the lymphatic circulation and the vascular, the vessel circulation. And the body can't clear that fluid. First steps are treating the infection, just as the individuals suggested. The veterinarian put the horse on antibiotics. That's common practice. Then working as vigorously as we can to reduce the inflammation as early as possible is important to prevent this chronic damage to the circulatory system. Once that chronic damage has occurred, recurrence, such as again was mentioned, of cellulitis is not uncommon at all. And oftentimes, even once the condition is as quiet as it's going to be, the limb will remain larger than the normal limb.
It's almost like with the suspensory or the suspensory ligament we were talking about before, where it loses that elasticity, it loses the ability to go back to normal. And so that, sounds like with that chronic recurrence, that's what you're seeing.
That's exactly right.
Okay, our last question submitted by Cameron, and this one came from Facebook. And Cameron is wondering, what should I do if I have an accident-prone horse who constantly hurts herself? I think we've all known a few of these horses in our lives. Keeps you busy, for sure.
An accident-prone horse is definitely frustrating, both from, I'm sure the horse is frustrated with it as well. I mean, not just us. But you have to try to identify why the horse is running into these accidents. I mean, it's one thing to have, if you have a single strand of electric fence for the paddock and the horse gets tangled up in it, that's obviously too obvious, Yeah. But you do want to set the horse, as you mentioned earlier, set the horse up for success. Make sure that the environment is as safe as it can be. Make sure the horse is understanding its environment, especially on things like if you're on a trail ride and the horse has never gone down a steep, rocky slope and crossing water. You want to make sure that you don't throw that whole challenge at the horse all at once. You might want to go down a rocky slope alone first. You might want to cross quiet water first. Don't throw all the challenges possible at the horse at one time. Stepwise understanding of the needs that horse needs to accomplish, and stepwise training is really important in helping prevent injuries. Beyond that, general conditioning of the horse, making sure that, again, no matter what the horse is used for, that the horse has the body condition, cardiovascular strength, all of that to easily accomplish its tasks. I can't run the Boston Marathon, at least not in this shape. Maybe in 9 months I could, if I was trained correctly. Same thing for your horse.
Yeah, I think it, kind of going back to the bog spavin and bone spavin before, where we talked about it's all of the other things that you're doing that result in those sorts of things. And I think it's the exact same thing here. You don't necessarily think of it the same way. You just think, oh, he's stocked up again, no, he's hurt again. But it's because you did something out of the ordinary. You did something he wasn't prepared for, and that we can challenge our horses in ways that we don't realize is challenging for them.
That's exactly right.
Well, that is all the questions we have. Thank you guys so much for submitting fantastic questions. Dr. Kaneps, thank you for visiting us here at SmartPak. We're always happy to have you. As you guys know, we are always on the hunt for new questions to answer, so we'll be taking questions until May 11th for our next video. And if you ask your question on Facebook, YouTube, Instagram, Twitter, on our blog, in the comments, you can email CustomerCare@SmartPak.com. Use hashtag askthevetvideo so we can track down all those great questions. And if your question was answered in this or previous video, you can email CustomerCare@SmartPak.com or direct message us on YouTube, and we'll make sure to get you squared away with your gift card, because people win for getting their questions answered and voted to the top. So as always, thank you guys for watching. Dr. Kaneps, thank you again for sharing your expertise with us. Don't forget to subscribe so you don't miss a video, because you never know who could stop by SmartPak next. Have a great ride.